Affordable Care Act, C, privatize, D, single payer, or E, socialize. Can we show of hands for A, current trends? Affordable Care Act, privatize, implement single payer, socialize. Okay, so let's move on. So the title of this presentation is Solutions to a Sick Health System. We'll go through three alternative public policy sets to address our problem, but first we must define our problem and establish the framework within which our health economy operates. So our problem is essentially that we have the worst health outcomes of the 20 richest nations, yet we spend twice as much on healthcare as the rest of these countries. We're bankrupting individuals is the leading cause of bankruptcy, and as this graph shows, with Medicare and Medicaid being the fastest growing, projected to 2040, it will bankrupt our nation. So to give us a little history, in 1950, President Truman was unsuccessful in implementing a national health program when cardiovascular technologies were really beginning to advance the frontier of the health market. And rather, in 1965, we passed the Medicare and Medicaid, which entitled the most vulnerable and most expensive populations to nearly unlimited care. Just before that, health expenditure was 5% of GDP, now it's 18% of GDP. This is contrasted to the United Kingdom, where they established and unified their National Health Service in 1948, and now only have 8% of GDP spent on healthcare. The U.S. may have bad health outcomes for the poor, but we do have shorter wait times and better technologies for the rich. My report further finds that the Affordable Care Act does little to effectively change our health system and rather forces people to buy into a corrupt health system, leaving our health system in a very precarious situation. So analyzing this market, we find it's very unique in that the government spends 51% of the $2.5 trillion we spend annually on healthcare. Why? Because market failures are rampant in the health economy. Health is a public good. People contribute more positively to the economy when they're healthy. Asymmetric information is seemingly inevitable, where doctors know more about medicine, patients about their own health status, and the third-party finance sees the costs. There's externalities in that good health promotes good health, bad health promotes bad health, and we have oligopolies operating in economies of natural monopolies, which allows market power to induce scarcity and make profits, most notably in the pharmaceutical industry, which has about 20% profits. And the interplay of this the interplay is very complex of all these market failures. One example is Sutter Healthcare in the Bay Area. By the Hirschenfeld Index, it has oligopoly power, yet it is a nonprofit. So now we kind of understand a little of how our health system operates. We'll go into some criteria, or we can go into analyzing our alternatives. In my paper, I go through it extensively. I encourage you to check it out. Analyzing by the criteria of efficiency, equity, and feasibility. However, we'll have a simplified analysis today. So on the privatization route, that seeks to eliminate government intervention in the health market. The Ryan Plan follows this route. The basic idea here is to provide to meet established entitlements through providing vouchers for private insurance. However, we've seen laissez-faire principles are counter-effective in markets with such market failures. And further, the Democrats would not allow a privatization model to pass when we have 50 million Americans uninsured. So we'll check out the socialization method. The socialization method would give control of both finance and delivery to the government. It admits that demand derives from people being unhealthy, and so it can coordinate environmental, public health, and medical efforts. We find it the most efficient. It will be able to force implementation of electronic medical records, standardized evidence-based practice, use remote care, and many other new innovations that hold great promise to reduce costs. However, in a nation so distrusting of the government and divided, we do not see this as completely, we see it as completely an infeasible alternative. So we'll go into single payer. and this is our recommendation. In single payer, the government collects taxes from everyone and pays for insurance for everyone. However, the providers are kept private and competitive, reimbursed all on the same schedule. So this is essentially the way every other health system operates, or every other industrialized health system operates. It allows the government to design incentives for a healthy public, so why don't we have a single payer? A simple reason is just that the conflation of political and economic power have allowed regulatory capture to the point where single payer is not even considered in our wasn't even considered in our most recent health reform. So it's my hope that we can unite our political sphere, our parties on this objective issue that could save a lot of money, and then unite to solve some of our other greater issues. So thank you. Are there any questions?
How many of you have changed your mind?
Oh yeah, so I guess if there's no questions, who would, who would support letting current trends continue? Good. Affordable Care Act? Okay. Privatization? No, not Berkeley. Single payer? And socialization. Yeah. See, I still would support socialization, but it's